explain to people is that I don't treat autism. And I'm not going to ask you guys to treat autism. What we treat are the medical problems that present in a child who happens to have autism. If a child with autism comes in with a broken arm, you are to treat it. Okay? If a child comes in and needs some sutures, you treat it. If a child with autism comes in with an ear infection, you treat it. So what we're going to go through today are the presentations of medical disease that will give you an opportunity to treat the child with autism by constipation. And in the process of treating the child, the constipation improves and now the child's sleeping through the night. Or the child's no longer doing self-injurious behavior. Oh well, you're treating the diarrhea, the constipation, the immune system deficiency, whatever we're going to talk about today. And in the course of that, I do see the autism improve. It makes it actually a lot more bearable. From a parent's perspective, when they come in to see you, autism presents with obviously behavioral issues, illnesses and pain, multiple delays, growth and muscle tone issues, isolation and stress. A lot of stress. What we're actually looking at when we think about autism is the mismanagement of incoming stimuli. Okay? Now, if you go to the DMS-4 criteria, what you'll see is that you have to have a certain amount of behavioral disruptions and language delays and repetitive behaviors. And if you meet the criteria, the DMS-4 criteria, they say you've got autism. But really, when I look at the spectrum of disorder, when I see this, if you have one child in this corner who is sitting there rocking, biting his wrist, doesn't know mom or dad or hunger or thirst or poop, and just rocking, doesn't know time of day, all incoming stimuli make absolutely no sense to him. If, on the other hand, in the other corner, you have a child who is doing great on the soccer team, has got lots of friends, and I'm just going to start this. Doing super, but when the teacher's talking about George Washington being the first president of the United States, was in the Revolutionary War, married a wonderful lady named Martha, it goes over his head, and in a week when she asks who's the president of the United States who was in the Revolutionary War, he can't come up with George Washington. We call that attention deficit disorder. We want to treat that. The problem is he mismanaged incoming stimuli. Now, his activities of daily living were not really that heavily impacted over here, but over here everything is. And then these kids come in on this spectrum. So, for example, my son can walk on hot gravel in bare feet in the middle of summer. Okay? The stimuli coming in from the bottom of his feet, though it was reaching his brain, did not get the appropriate response. Should have been owing, crying, getting off the gravel, something. These kids will put their hands on hot stoves. And they get burned, and you take care of the burn, and what do? 5 minutes later, they do it again. So something is really wrong with that. So the five senses do bring information to the brain. They don't have a spinal cord transection, okay? But something is altering how the information is perceived by the brain and dealt with by the brain. Well, there is a genetic influence. Everybody says, oh, it's genetics. I've been doing this for a long time, and they kept saying, well, it's genetics. And we know that there's no such thing as a genetic epidemic, but there are genetics involved. I mean, you can be born allergic to cats, but if you're never around cats, you're just fine. But put cats beside you, and that unmasks your genetic predisposition. So a lot of people think about vaccines these days as causing problems, and maybe that genetic predisposition not to do well with something in the vaccine, whether it be formaldehyde or aluminum or the vaccine component itself, whatever it might be, or the smog or the arsenic mom was exposed to in the chicken factory or whatever, something comes along and unmasks the problem. It involves the body and the brain. Okay, so the brain, remember, receives everything downstream from what's happening in the body. There are metabolic, immunologic, gastroenterologic, neurologic, and endocrine abnormalities that we as physicians and healthcare practitioners have the opportunity to not only diagnose, but improve, just like we do with the adults. Now, are there any pediatricians in this group? Okay, so we mostly work on adults in this group? How many are taking care of autistic children in their practice now? Okay, good. Okay. How many want to take care of autistic children? Oh, I'm sorry. No, that's really good. We need more of that. What I'm trying to do is paint a picture of, just like from our adult literature, if something is wrong hormonally, you're going to attempt to fix it, correct it, and then you'll look back and say, now that we have corrected the progesterone deficiency in this mom, she now, see, I'm a pediatrician, I'm calling her a mom, this lady, now she's able to think more clearly. She now has a feeling of wanting to love and give love. Her skin's feeling better. Same thing with the kids. When we even address their hormone issues, they feel better. There is an amount of the ability to treat these kids and a degree of recoverability, or the cure word. Now, let's define cure, okay? Because I have a court case coming in on Monday, and they're going to want to talk about curing autism. And like I say, I don't work on autism. I don't cure autism. But our goal would be to, especially with these little kids who come in when they're 2 and 3, is to get them into kindergarten. They're going to be quirky. They're going to be kind of weird. They may need an aid, but that's what we try to do. Now, I look at the word recoverable as I would look at a broken arm. Can we recover a broken arm? Sure. So if we find out a child has hypothyroidism and constipation and we fix that, did we treat it and cure that component? Yes. But the whole picture of autism, we may not be able to impact that greatly just with one intervention. So what are the things that make these children biologically different? These are just a shopping list of things that you can use in your differential diagnoses, in your little Rolodex, as you see a child get their history and their physical, of things you're going to be thinking about. From the gut problems, inflammatory bowel disease. Okay? Now, a lot of you have heard about how Dr. Andy Wakefield was defamed. He lost his medical license to practice over this. But I'm not saying anything about Dr. Wakefield. But in the course of his studies, there was endoscopy done, there were biopsies obtained, and pathologists have reviewed it and said these are inflammatory problems in this child's bowel. That was never disputed. It was the first time that somebody actually found out that autistic children, a group of them, have inflammatory bowel disease. Now, we all know that inflammatory bowel disease is something that we can treat. We might have to use Pentasa, we may have natural ways to do it, we may improve it by removing certain foods like gluten and dairy, but it's a treatable entity. At least we can make it better. Nobody talks about recovering from inflammatory bowel disease until you get into A4M kind of medicine, but it's something we can do. Now, inflammatory bowel disease or reflux esophagitis or gastritis, these things hurt. So these kids live in chronic pain. And because it's inflammatory, it waxes and wanes, so you get these kids who have some days that are okay and some days that are just terrible. There are immunological problems going on with these kids, from persistent viral illnesses, recurring ear infections, recurring pneumonias, recurring sinusitis. And, you know, they can go on 30 antibiotics, they can get ear tubes, and nobody's even done an immune system workup. I mean, that's basic form. Let's look at your IgG levels, look at your IgA levels. Let's see what's going on here. Maybe you have an immune-compromised position. In other words, even though you have autism, you may have a medical problem, like, you know, appendicitis. Maybe we ought to take a look at some of these things. Neurologic, 30% of the kids that I see have a seizure disorder. Low muscle tone, perfusion defects, opiate effects, and then there's a whole bunch of delicious metabolic interventions you can incorporate in your practice to make these kids better. And of course, there's always a issue of concerns. Now, I'm seeing now with the new microarray tests, all these funky little things that are missing, or they have these, what they call SNPs, single nucleotide polymorphisms and stuff like that. I don't know what they mean yet. People come out and say they know what they mean, but I don't know what they mean, because when we go to correct them, things don't change. You almost have to wonder, if we did these microarray tests on neurotypical kids, would there be a certain part of that population that would, you know, pop out some of these things? But they're not manifesting it. The phenotypic demonstration is not there. So we're going to think about getting these kids improved by removing dietary environmental stressors. I mean, a child who is refluxing dairy products, you know, from the formula from birth and still drinking a gallon of milk a day, it might behoove us to remove that from their system and see if they get better. Environmental stressors, bolstering nutrition. You know, a lot of these children have limited themselves to maybe eating 3 or 5 things. My son was only eating Chips Ahoy cookies, bacon, Fruit Loops, French fries, and a gallon of milk a day, and I was okay with that early on in my training here. Relieving inflammation, improving broken biochemistry, improving immune function, and detoxifying them. I think that's kind of an approach that we use with our adults as well. Now, back in 1943, Dr. Leo Kanner coined the phrase autism, turning into self. But it's kind of interesting that when you look at the cases, actually read them, not just kind of glance over, but actually read them, you'll see that there were a lot of medical issues. Case number 11 was given anterior pituitary and thyroid preparations for 18 months. So something was going on glandulally there. No surprise with some of these kids. Case 7, vomited all food from birth through the 3rd month. I see that a lot. Okay. Poor nursing in case 5. This seems to coincide perhaps maybe with, some people will say, with the introduction of vaccines in the 30s. Okay. Some of the vaccines actually came into play then. We don't know. It's just one more consideration. But we can translate our physical findings into meaningful medical interventions that you guys can employ in your practice. And let's look at the bowels, and that's kind of where I always start. Whenever I have a new patient, I always start at the bowels. And I'd probably say at least 90% of my kids have bowel issues. 10% don't.